Bonjour, everybody, and welcome to our podcast. My name is Michael Heguy, president of Galien Group and exclusive distributor of Bauerfeind AG and Bosel Lymphomat, both Class 1 medical devices in Canada. Today, we're talking about how patients can better manage lymphedema and lipedema at home and the role of intermittent pneumatic compression, which will be referred to as IPC. I'm joined today by Marie-Ève, who works closely with patients managing lymphatic and venous conditions. Marie-Ève, can you start by telling us a little bit about yourself? And thank you for taking the time to talk to us today.
Thanks for inviting me. So I'm Marie-Ève Letellier. I'm a kinesiologist by background. And after my master, when I started to work, I discovered the world of lymphedema, which led me to do my training to become a lymphedema and lipedema therapist and move on into my studies to do my PhD. So now I work as a clinician and researcher, yes, based on evidence, but also informing myself with what the patients are going through to help the other patients that I'm following.
Great. So let's start with a simple question. What is lymphedema?
So lymphedema is a chronic condition, which means that it's lifelong. It has inflammation, and lymphedema refers to a buildup of fluid in your tissue. The main causes of lymphedema are chronic venous insufficiency, obesity, but what we're hearing the most is after cancer treatment. But you can also be born with a lymphatic system that is deficient, which we would call primary lymphedema.
Thank you for your explanation. Right now, there's a lot of confusion in the Canadian market surrounding the difference between lymphedema and lipedema. I'm sure that happens in a lot of different countries around the world. Can you explain to us what the difference is?
Yes. And you're right, there's a lot of confusion, and quite often, lymphedema, lipedema, and obesity, the three of them are confused altogether. So, lipedema is a chronic fat disorder affecting mostly women. So, the women will have pain along with asymmetrical, abnormal fat distribution. For example, the ankle will be quite small, the waist as well, but in between, you will see both legs having abnormal fat distribution. And both lymphedema and lipedema are long-term condition that requires long-term management.
All right, well, thank you for that explanation. What I'd like to know is how is your day-to-day working with these patients and treating them? How does that go? Can you explain a little bit more?
Yes. So, as a clinician and researcher, my first goal with the patient is to educate them on management. The conventional therapy for both lymphedema and lipedema is combined decongestive therapy, with the number one element being compression. So, compression either through compression garment, bandages, or Velcro system. Bauerfeind has an amazing custom-made garment, which is called the Curaflow, which is made longitudinally with high and low pressure zone, which will mimic and facilitate the flow of the lymph. So this is an amazing garment to use. So our goal with the therapy is to be realistic for their everyday life.
So tell me, how does IPC fit into your treatment approach?
So when we work with lymphedema and lipedema patients, we need to give them a toolbox. So IPC is one of them. It's useful and it's supportive. It can be used on a daily basis or just once a week, depending on their need. So they need to find their own recipe. So for lymphedema, for example, it can help to reduce their swelling. For lipedema, it will help to support their symptoms like pain or heaviness. And IPC can also be used with athletes just for sport recovery. So IPC will be used in a clinic setting, but most importantly, it will be used in the home setting at their own time for their own benefits.
Can you tell me about the key clinical benefits of IPC?
Yeah, so the basal pump has 12 overlapping chambers that goes through a sequence, which means that it will inflate from your toes up to your waist in a sequence, and then hair will release. That will move the fluid up. It will mimic the lymphatic massage that we do. So it will increase the lymphatic flow and the venous flow as well. And it will reduce the volume and heaviness. It does not replace therapy, but it's a nice complement to have.
So, Marie-Ève, what is the feedback that you receive from patients that you referred to IPC for?
They just love it.
Nice.
They find that it's relaxing. They can use it while they're watching TV, so they can do both things, improve their legs and relax at the same time. They find mostly that it's easy to use. The pressure that is induced by the pump does a little massage that do a good snug. So patients feel that they have the control of their management. They do it also on their own schedule when they have time. So down the road, it improves adherence and the long-term outcome of managing the condition. And it's also good for those that are living far from a therapist. They can do it on their own and think right now we're beginning of May. Summer is coming up.
Hopefully, yeah.
Heat is coming up as well. So therefore, it will help to control as well the swelling that can be caused with heat.
All right. What advice would you give somebody who is starting IPC treatment?
First, to start gradually and be consistent. It also needs to be combined with Curaflow garment. So to maintain the benefits from both the pump and the compression garment. And before you start, some guidance may be required through a clinician to see if you do have indication or contraindications to use the pump.
At Galien, we're very proud to say that we have the Bozal Lymphemat and all the sleeves and accessories in stock that we can ship, as we said, across this huge country of Canada, mostly within 24 hours.
That's incredible that people can have access that quickly to a medical device. So right now, there's a lot of pumps that are available through internet, which are not medical device. And for me, dealing with lymphedema and lipedema, that are two medical conditions, it is quite important to treat those conditions with a medical device.
I agree. I think it's really important to be treating lymphedema and lipedema with a registered medical device like Bauerfeind Curaflow and the Bozal Lymphemat. So, what are your final thoughts on the topic?
I will support you definitely on that. So, to treat those two conditions, we need compression, as you mentioned, through the Curaflow or the IPC. And you need consistency is the key element to help that condition. So the toolbox needs to be filled, and IPC is definitely one of them that make it possible.
Well, great. That's our time for today, but I just want to thank you so much for being here with me and sharing your expertise. Thank you very much, Marie-Ève. And I want to thank everybody out there listening, and we'll see you next time.